My name is Dr. Chris Hartnick, and I had asked Jesse's mom to come in and talk to us about the hypoglossal nerve stimulator because I wanted other parents to get a sense of what it was like for her to make a decision to put new technology in and to do a surgery that has never been done before. And maybe other parents were asking very similar questions about how do I feel about new technology, and what are the risks, and what are the benefits, and what questions should I be asking, and how did it go? And so to set the stage, this is a hypoglossal nerve stimulator, and what this is designed for, it's like a pacemaker, and it's a pacemaker for kids who have Down syndrome and who have very severe sleep apnea, despite the fact that they've already had their tonsils removed, because as probably all of you who are watching this who know, your children who have Down syndrome, most of the sleep apnea is because of the tongue can be very, very large and can obstruct at night. And we can try to use CPAP, which is a mask at night, but so many of your kids may have sensory integration issues and it'd be very hard for them to wear a mask at night, as I'm sure you know. For kids who have terrible sleep apnea and it's putting a strain on their hearts, which may already be strained because of other symptoms of Down syndrome, sleep apnea can be very hard on the heart. And sometimes we think about putting a trach in, which is a tube that's in the neck so that they can breathe. And we definitely don't want to do that. So for those kids who are either trached, where we want to remove the trach, or those kids who are age 10 to 21 now but have Down syndrome, severe apnea, and can't tolerate CPAP, this is a device that will, when they are asleep, sense that they are breathing or trying to breathe, and then it acts by a little wire that sits underneath your, right underneath their rib cage, but under the skin so they never feel it. Goes up, and there's a little, this is a processor, this is the current processor, and this is the new processor, and it's much smaller now, and this one you can have an MRI, whereas this one you couldn't have an MRI before, but it registers that your child is trying to draw a breath, and then it sends a signal through another wire which goes up right in just below the tongue to the nerve that moves the tongue forward to tell the tongue, your child's trying to breathe, so the tongue should move forward so that your child doesn't obstruct. And that's the rationale for this procedure.